You are watching the video abstract for the article Characteristics and Outcomes of COVID-19-associated Stroke, a UK multi-centre case control study. My name is Richard Perry and I'm presenting these data on behalf of the CETICOS collaboration between 13 stroke centres in England and Scotland in the UK. We collected data on stroke admissions between the 9th of March and the 5th of July 2020. Among these, 86 patients had evidence of COVID-19 at the onset of their stroke, and these were our cases. They were compared with 1,384 patients who never had any evidence of COVID-19, and these were the controls. There's been a good deal of discussion in the literature about the idea that COVID-19 associated stroke may occur in younger patients, but we found no evidence to support this hypothesis. As you can see, the distribution of ages was very similar in our two groups. On the other hand, the proportion of Asian patients was 17.6% in our cases and only 7.3% in controls, a highly significant difference. There was no difference, however, in the proportion of Afro-Caribbean patients in the two groups. The proportion of patients who had an ischemic stroke, as opposed to an intracerebral hemorrhage, was significantly higher in the cases than it was in the controls. And now looking at those ischemic strokes, we measured the severity of stroke on admission using the NIHSS. You can see that the score was significantly higher among cases, shown here in red, than it was in controls, shown here in blue. We then looked at the radiological findings. The proportion of patients who had at least one large vessel occlusion on CT angiography was about the same in the two groups. But when we looked at the proportion of patients who had multiple large vessel occlusions, this was significantly higher in the cases compared with the controls. As a marker of coagulopathy, we measured the D-dimers in our patients, and you can see here that the values were significantly higher in the cases, shown in red, than they were in the controls, shown in blue. And indeed, in the cases group, the distribution was much broader than in the controls group. Turning now to the patient's discharge, the cases had significantly greater disability on discharge than the controls. And the mortality during admission was more than twice as high in the cases as it was in the control group. So in conclusion, COVID-19 does appear to have a significant impact on stroke. The proportion of ischemic strokes was higher in the COVID-19 group, and looking at those ischemic strokes, the severity was higher, the mortality rate during admission was higher, and the disability on discharge was also higher. There was an association between COVID-19 and the finding of multiple large vessel occlusions on CT angiography. And finally, coagulopathy may be playing a part here in that there was a higher and broader distribution of D-dimers in the COVID-19 cases compared with controls. Many thanks for your time.